Have you ever received an appointment letter from the NHS that actually came through your letterbox after the consultation date, sometimes days afterwards? Well, you're not alone if you did, because 1 in 5 people, according to a new report that lays bare the health system's admin failures, say that they've been through exactly that experience.
What a waste. Well, the study also found that almost 2/3 of patients have faced at least one admin problem over the last year. Is this proof the NHS needs to digitise faster and go paperless? To discuss this, we're joined by broadcaster Albi Amankona, who thinks the NHS is lagging behind, while broadcaster Nina Mishkov says there are risks to phasing out paper too quickly. Good morning to both of you.
Hello.
Nina, start with you, because, you know, when we look at things like the number of people receiving a letter for an appointment after it's taken place, I mean, what a waste. Isn't that a sign that we need to kickstart getting everything digital?
Everything, of course, we're moving towards a digital age. It's like we're moving towards a cashless society. And, of course, that's got to happen. And the NHS should be all joined up. But a lot of the problems with the letters I would have put down to the Royal Mail, because we have a truly dreadful mail service, which doesn't, you know, solve the problem at all. But the thing is, go digitise, but what about the older people? What about the 3.3 million over 65 who don't have a smartphone? I mean, Richard and I were very lucky. We, you know, born way before smartphones, but because we were journalists, we were early adopters. So I can do all of that. I can do all of that stuff and have done for decades. But there are people who can't. But even I, you know, who can... I would like a bit of paper, because actually... you remember it more. You stick it on the front of the fridge or the back of the kitchen door, and you've got something there. A letter comes on a small phone, and you try and read it. And sometimes it's 2 or 3 pages, because it's telling you how you should turn up and what medication you should bring with you. And you're scrolling, you turn it landscape, and you're scrolling. But older people, eyesight not good, maybe arthritis, and they're fumbling there, and they don't have the basic skills. It's not their fault.
It's hard to argue with there isn't it? That there is a section of the population who are just as important as younger people and middle-aged people. They're just as important. In fact, you could say in some ways they're more important because they've paid their dues, who are left behind by technology and are intimidated by the idea of getting their appointments digitally, because, as you say, millions of them simply don't have one of these, and they don't have a laptop. They rely on paperwork. So if we go 100% digital, they're going to be completely left out.
It's a very small section of society, and those advocating for a digital NHS advocate for there to be an opt-in if you want to be digital, or an opt-out if you want to still be paper-based. I sort of feel that it's unbelievable that we're having this debate. It sounds like we're in 2001. It's 2025. We've been having this digitisation discussion for over 20 years. The first announcement for the NHS to be made paperless was back in 2013. So it's actually already been decided that going paperless is better, but then it was pushed back to 2018, then it was pushed back to 2020 because of the pandemic. The last target was 2024. We're still not there. We need to get a move on and go digital, fully digital, in the next 12 months.
When you say fully digital, do you mean fully digital, or would there still be recourse for people who don't have these devices to get their appointments and all their correspondence in terms of their health via the post?
As I mentioned before, I think there should be an opt-in if you want to go digital and an opt-out if you're one of the very small numbers of people who doesn't have a smartphone or who finds digital technology intimidating.
All right, can I tell you then, as somebody who's reasonably fluent with this, but not as fluent as my kids who are in their 30s, I would opt to have both. I would still want the paper backup.
Why?
Because I'm not as confident as you are with this. I'm just not. And when it comes to something as important as my health, I'd rather be safe than sorry. So I'd rather be sure that I had my appointment, sure that I got my results from tests and treatments as backup on paper.
But what if you were one of the 1 in 5 people who got a piece of important NHS correspondence after the appointment had taken place?
I would still rather have the option, potentially, of getting it in the post. Now, I'm not saying that I would utilise that. I think I would be capable, I know I'd be capable of dealing with it digitally. All I'm saying is that I would actually opt to keep to keep in the paper system, just in case.
OK, well, Nina, what do you make of it, you know, whether we have sort of an opt-in or an opt-out system on this?
They're still not going to help for old people because, you know, how are they going to know how to opt in or opt out? You know, Albie...
What would you do? Would you opt out or would you opt in?
No, I want both. You know, there's a bit of paper. It's very hard to ignore. You know, there's so many missed appointments anyway. People, you know, even if they've got the information, don't turn up. And this would help with this. But, you know, I'm really shocked that Albie keeps saying dismissively a small, you know, section of the population, small section of the population. You know, it's a very valuable section of the population. It's millions of people. It's not tiny.
There's also another factor. This time last year, I had this nicked. I was having Sunday lunch with my wife in the pub. Somebody came along, did a nice little shimmy with a magazine, and 2 minutes later I realised my phone had gone. It took me nearly 2 weeks to get back online, to get sorted. Now, if I'd needed important correspondence to do with my health and I was only on digital, I would have been screwed.
And there is the risk of data breaches, isn't there?
Of course there's a risk of data breaches, but in a world where many public and private sector organisations have gone digital, let's take banking, for example. We trust banks to have gone digital. Why can't we trust the NHS to go digital? We trust the HM Revenue and Customs to go digital. Why can't we trust the NHS to go digital? And I'm not being dismissive of older people when I say it's a small section of the population. I have said there should be an opt-in and an opt-out. But we've got to look at the benefits of going digital. This will save money. A lot of patient records are still physical. A lot of these physical databases are actually on valuable hospital land, which can actually be used for medical uses.
Nobody's arguing the fact that the NHS needs to be joined up digitally. What I'm talking about is the possibility of people not getting letters, something physical they can hold. You know, in a way, Albie, it's not your fault. You were born. You know, you were born in an age where mobile phones already existed, and I'm sure you can't possibly imagine how people, you know, managed without. You know, but the thing is, you couldn't manage without your phone, I bet.
I could.
I bet you could. I bet you could.
I can read and write, so I'd be fine.
All right, listen, let's call it a day there.
That's our close. Thank you both very much for that.
Listen, obviously, we went to the NHS about this, and they told us, look, we know we need to go further to make sure that patients have the information they need in the right place and in a timely way. And taking up your point, we went to the Royal Mail as well, and they said, we know how important NHS letters are, and we've been working with NHS bodies and patient groups. We've implemented changes in our network to improve the timely delivery of medical letters.
And we did ask you if the NHS needs to digitise faster. This is how you voted. 83% said yes, 17% said no, although obviously we do have to point out, you know, it's the more digitally savvy people that will have been voting.
Even so, that's a victory for your argument. 83%, that's big.
Thank you both very much.
Thank you both.